You're on.
Okay. Hello, I'm Dr. Phil here at Orange County Sports Fighting Disc, and today we're treating a patient. You're playing basketball?
Yeah,
All right.
basketball.
Can you tell us what happened?
Yeah, I just took a knee to this thigh for multiple. It's happened multiple times. This last time was like debilitating. It like hardened the tissue and just gave me just a contusion. I was limping within a minute, like for the last. Yeah, this is a severe like type 3 probably contusion.
All right. Here's what happened to Kevin. He likes to play basketball, and people don't know this, but basketball causes the most sports injuries out of any sport, more than hockey, more than football. You're playing on a hard court, people are elbowing you, kneeing you. In this case, Kevin took it in the lateral thigh, and what happens with a contusion is the muscle is mashed against the bone, and that breaks blood vessels. So what you don't want to do, the last thing you want to do is massage it or rub it, because you got a deep thigh bruise, and with the contusion you could cause more internal bleeding, and the more times you injure that and the more you rub it, you get a condition called myositis ossificans, which is the scar tissue will actually turn to bone because you keep on irritating it. So the last thing you want to do is rub into it or massage it. Here's how I handle a contusion to the lateral thigh. You bend the knee like that, okay? And today we're going to use this Class 4 laser therapy. And what this will do, it'll increase the healing response. It's a biophotonic response, biostimulation. So this photobiostimulation will bring in blood, fresh blood for circulation, and it'll also increase the healing factors by bringing in oxygen, right? Taking out the bad fluids, the dead pooling of the blood. It'll also decrease the rate of scar tissue formation, okay? And that will decrease the swelling and inflammation. After we do the laser, what you do is we're going to pack his thigh with ice, okay? Basically we want pressure, rest, ice, compression, elevation. We want the pressure to control the internal bleeding. We want the rest because we don't want any more inflammation to accumulate. We want the ice, again, to decrease the inflammation, constrict the blood vessels to take out the waste products. You want the you want the compression, right, to control the bleeding. You want the elevation to drain the blood. So you want the level of the leg above the level of the heart, so it drains. Otherwise you get a pooling of the blood in the lower extremities. Now I like to add an L to that, so price is L. I want the laser to metabolically increase the healing time by 2 to 3 times. Okay, now our nurse Lauren had done this for about 8 minutes before, but I'm just kind of putting the finishing touches. Again, you don't want to put any mechanical pressure, just light pressure like that, so the laser can penetrate the tissue. Now, after we apply the laser, we immediately, again, flex the thigh. Hold that for me, Kevin. And we're going to strap them in ice. Let's get it nice and tight right there. Now, he's going to hold that for 20 minutes, okay? And after 20 minutes, start pulling that back. Want it tighter. There we go. Compression. Okay. Pack that baby in ice, 20 minutes on, 20 minutes off for the next 48 hours. Then we can switch to heat, okay? And then maybe next week you come in, we can do some very soft tissue, myofascial release, to make sure the scar tissue is not building up, and get this guy back into basketball, which he loves, okay? Thanks for watching. This is how we treat an acute contusion to the thigh. Thank you.